Right. Good morning, good evening, whichever part of the world you are in. And thank you, Mr. Akil Ahmed, for setting the stage and giving the opportunity. Just a quick intro about myself. I've been working in this industry for 18 plus years, basically in healthcare technology, management administration, more so focused on automations, IPAs, and off late moving into AI, ML, and have also started working on the Gen AI related applications as well. A little bit disclaimer, I am here to represent myself and my expertise, not representing my organization. So that being said, let's move on to the next slide and about my topic. So how can blockchain augment automation in healthcare? Let me help you imagine a healthcare experience, something like tailored to you, which gives you customer recommendation you receive when you, let's say, open a Netflix, or those nosy ads which seem to read your mind and suggest what you want to browse. This vision of personalized care is no longer confined to imagination. It is a reality which is now being shaped by blockchain's transformative influence on healthcare administration. Now, as we find ourselves swiftly evolving in landscape of 2024, blockchain technologies such as Ethereum 2.0 and Hyperledger Fabric are taking center stage. They're often unparalleled scalability, security, and efficiency, which is crucial for managing the healthcare data. Now, in the subsequent slides, we will touch upon the tangible impact of blockchain on healthcare automation, specifically in the field of healthcare administration. We had the few panelists earlier who talked in extent about clinical and biotechnology. Now, let's check or touch base the other aspect of healthcare, which is as important as the clinical part. So let's uncover the applications which are reshaping the healthcare delivery. Let's talk about AI and blockchain. So the convergence of blockchain and AI is transforming the healthcare industry. It's empowering patients, enhancing data security. It's driving medical innovations. So by embracing transformative potential of blockchain and AI, healthcare providers and stakeholders can lead towards a more patient-centric, efficient, and interconnected system. Now, firstly, the integration of blockchain and AI is transforming health records management. As we heard the previous speakers, EHRs, they form a very, very key important aspects of overall blockchain data management in healthcare. So when combining or having a synergy with AI, it's transforming the health records management such that blockchain, it ensures integrity and transparency, while AI on the other side, it's offering insightful analytics for personalized treatment, which is the focus of AI and blockchain. Now, in supply chain management, this synergy enhances traceability and efficiency. It reduces risk of counterfeit drugs, optimizing resource distribution. The drug development and the clinical trial process is accelerated, and they are made more reliable with blockchain ensuring data security, AI analyzing clinical trials for faster insights. Telemedicine and remote patient monitoring, they are the in thing right now. They are reaching new heights. Secure data transfer via blockchain, real-time health monitoring through AI. They are enabling better patient care outside the traditional settings. And lastly, we have the precision medicine or the smart medicine, which is like blockchain secure management of data, genomic data combined with AI's analytical capability. They are providing highly personalized treatment. And coming more towards the administration and healthcare management, we have the healthcare payments and insurance claims, which are being very, very efficiently being managed and securely as well in a faster way by AI and blockchain synergy. Let's move to the next part or next application in the healthcare administrative automation, which is blockchain security for remote monitoring. So we have heard about this Internet of Things. So let's move to the next level, which is Internet of Medical Things, IoMT. It represents transformative models in technology and healthcare respectively. So IoT encompasses a vast network of interconnected objects capable of real-time data exchange. While IoMT, they extend the connectivity to medical sensors, devices. They're offering remote monitoring and personalized care solutions. However, the rapid expansion of digital healthcare technology, and we had the recent COVID pandemic, it highlighted a very, very critical need for robust security management to safeguard sensitive patient data from cybersecurity threats. We heard about the 3 a.m. cybersecurity which impacted lots of hospital chain networks in the United States. So blockchain technology, it combines with smart contracts. They're emerging as a formidable solution to address these security concerns. It's a decentralized platform which ensures tamper-proof security through cryptographic authentication and distributed storage systems. They minimize the risk of unauthorized access or data manipulation by the cyber threats. So we eliminate the reliance on central intermediaries. Blockchain enhances data confidentiality and privacy and makes it an ideal choice for securing IoMT data. Blockchain also offers numerous benefits for medical research, healthcare providers, and individuals, enabling efficient data management and accurate access control. Overall, in essence, we can say blockchain technology stands as a cornerstone of trust and security in the landscape of IoMT, thus facilitating innovation. They are protecting patient privacy and data integrity. Moving to the next part, which is this is a very interesting aspects of blockchain in healthcare, which is called it transcends healthcare and across industry, but in healthcare, smart contracts, they are playing a very pivotal role. So in a simple terms, smart contracts are like simple programs which are stored on blockchain that run when predetermined conditions are met. They are used to automate execution of an agreement through all participants, which can be immediately about the certainty of the outcome. They don't need any intermediaries or any middlemen, and thus prevents any time loss. So smart contract in healthcare, they're employed to automate tasks like insurance claims, patient consent, management, and supply chain tracking. They securely manage healthcare records and ensure the execution of predefined conditions and agreements. When we utilize smart contracts in healthcare, we could potentially save thousands of lives annually by enhancing patient medical data records, drug supply chains, and medical collaborations. Blockchain technology, along with smart contracts, offer essential tools for automation and enhancing the management and storage of health data. They are revolutionizing healthcare applications overall. Smart contracts, they also play a crucial role in ensuring consent, storage, and legality of data processing. Thus, they eliminate ambiguity, which is associated with lots of data. They increase efficiency. They also reduce the risk of default between the two contracting parties. They define the contract terms in code. They execute instructions without intermediaries, and they register the contract on a blockchain. This innovative approach eliminates the need for human confirmation and relies on program logic. Decision-making streamline the process, and they enhance security in the overall healthcare transactions. So if you summarize the integration of blockchain technologies and smart contracts, they hold immense potential to revolutionize the healthcare system. They ensure better patient data outcomes and security while minimizing the errors and inefficiencies. Move to the next slide. So this aspect was already covered in detail earlier. I'm just touching few more additional areas how blockchain for EHRs can be effective. If you recall, in 2016, Johns Hopkins University, they published a research report which shows that medical errors were the third leading cause of deaths in the United States, often due to mistakes like incomplete actions or errors in patient records. For a first world country, this is like absolutely non-acceptable. Now, because of the worries about data breaches and rules to keep the data safe, healthcare organizations and the entities, they are turning to blockchain to store their health records securely. One of the great examples of leveraging blockchain to manage EHRs is something called a PCEHRM, which we expand the acronym to Patient-Centered Blockchain-Based EHR Management. Now, what PCEHRM does it lets patients control who sees the record without needing a central place to keep them. With this system, a care team member, they can see the records and they can start making their own new ones. The blockchain, they keep track of who made a record and when, and which is very useful in EHR dependent processes like insurance claims. To make the record, make sure that the records are not changed or they are immutable, the blockchain, they create a unique code, which is called as health data hashing for each new created patient records. Now, patients, they can easily access their records through apps or patient portals, as the blockchain solution enables multi-factor authentication for system login and private ID-based authorization. Blockchain can also help with doctor referrals, appointment scheduling, all thanks to smart contracts, which we learned about in the previous slide. Now, to keep everything or the data safe and follow the privacy and regulatory security regulations, the system uses health data encryption, which is kind of a role-based access management, and it employs what we call as fraud detection algorithms. Now, if a patient is using remote patient monitoring, the reports get added to the blockchain too. So by using blockchain for EHR, people can keep their health records safe. They can make sure everyone is involved in the case and they have the right information and right access to them. Move to the another very important aspect, which is the medical supply chain transmission. I'll spend a little bit more time on this slide. Now, recent surveys which have been conducted show that almost 64% of pharmaceutical companies, they are either currently integrating or they are planning to integrate blockchain technology in various aspects of their operations. This includes applications such as collecting clinical data research, managing logistics, and transactions in supply chain. So these pharmaceutical organizations, they want to recognize the potential of blockchain to address challenges within the supply chain. They want to improve the transparency, coordination, where the traditional processes often encounter breakdown. A key driver to adoption of the blockchain in pharma is the 2013 Act, the Drug Supply Chain Security Act, or the DSCSA Act of 2013. This legislature mandates that the compliance requirement for all the participants in the drug supply chain over 10 years, the manufacturers are required to serialize the products or lower at the lowest saleable level and share the data related to product details, manufacturing, trading partners, as well as the ownership change whenever that happens. This process, while essential for traceability and safety, they possess challenge in managing the sheer volume of electronic connections, ensuring data accuracy. Now, this is where blockchain comes into the picture. Now, blockchain technology, they offer solution by providing transparency and clarity on the transaction of the data, which is part of the overall supply chain. When we leverage blockchain technologies or platforms like Ethereum, Hyperledger, and Web3.js, these pharma companies, they can establish secure exchange of currency and data between the unknown parties. They enhance the trust and enable seamless compliance with these SCSA requirement, including serialization and unique product identification, which is one of the aspects of the requirements. Now, in line with the DSCSA requirements, all the trading partners in the supply chain, they must engage in appropriate licensed partners and have systems in place to verify product legitimacy and investigate counterfeit or unsafe products. Dr. Mustafa, he talked about this in detail earlier about how severe can the impact be about these counterfeit products, specifically in the drugs area. Serialization is another aspect, which is mandates that the products, they carry unique identifiers, such as the global TIN, which is the global trade identification numbers. They can be combined with additional data like serial numbers and expiration dates. They can also be having barcodes or RFIDs, which are the in thing about the smart supply chain, which we are seeing the utilization in other areas. This is where blockchain really helps, integrating the data, the unique data which has been assigned to each of these products with these RFIDs and the new other supply chain technologies. They must, blockchain also ensure that they must be universally interpreted. They are present in all the packages across the supply chain. They ensure that data accuracy and compliance as well. So overall, we can say blockchain technologies, they offer a promising solution to enhance transparency, traceability, and compliance with the pharma supply chain. And they are addressing the critical industry challenges while ensuring patient safety and regulatory adherence. I know I'm almost close to the time. I'll quickly wind up last couple of slides. Let's talk about one of the very interesting aspects of blockchain and AI, which is the decentralized identity system, also called as the DIDs. They are key to the digital healthcare landscape. I've been utilizing this as some of my implementations recently in some of the projects, where we have the patient data, which is scattered across various medical professionals and facilities. Now, when we utilize DIDs, the patients, they gain ownership and control of the healthcare data. Previously, without DIDs, we had like the coordinating and sharing of the data was really challenging. They required unique identities, unique authentication, and access-related remote access and other access-related credentials every time someone wants to access patient data. Now, with the emergence of DIDs and verifiable credentials, we call them VCs in short form. So the DIDs and the VCs, they are supported by blockchains. They are revolutionizing the decentralized entity authentication. They allow patients to access, review, amend, and control their own data. Now, blockchain-based decentralization, this DID or the identity management, they are enhancing security, privacy, and scalability in healthcare systems compared to central identity management system. Now, traditional systems, they are susceptible, they are kind of very vulnerable to single point of failure and data breaches. While blockchain-based solutions, they're offering secure and transparent access to patient data, while the patient is retaining the control over the data sharing permissions. So they have the magic wand in their hand, who they want to share across their data with. Now, this approach facilitates transparent, secure identification, authentication across different e-health domains, such as the healthcare IDs. These healthcare identifiers, they are attested by healthcare regulators, they are indexed on the blockchains, and they are stored by the identity owners. We talked about the health data hashing. So this health data hashing is a key aspect of DIDs. They also are stored by identity owners, thus ensuring transparency and security. We move to the last slide of this presentation about tokenization. Very honestly, I learned about this tokenization just a few days back while I was researching on the topic of blockchain and healthcare. This was like really exciting thing. Now, what happens is healthcare sectors, they face significant challenges in managing and securing vast amount of data, including the EHRs, the clinical trial data, and billing information. Now, tokenization has emerged as a solution to enhance data management and privacy in healthcare. Tokenization involves replacing sensitive data with non-sensitive tokens, which lack meaning or value outside the system. Imagine it like you go to a game parlor or something. They give you small tokens or some cards to swipe in. If you lose that card, you don't really lose the money as such because it's secure. Maybe it's secured by some code or some kind of a password. So similarly, on more securely, tokenization is really helping how your data is being transferred across the blockchain. So these tokens, they are used for data analysis, for processing and storage, while the original data, which is the patient healthcare and PHI in most cases, they are stored securely to mitigate the unauthorized access. Now, during the tokenization process, the adherence to appropriate token standard, which is really crucial. Token standards are predefined rules which govern how the tokens are implemented and interact within the blockchain ecosystem. These standards, they ensure consistency, compatibility across various applications and services such as wallets, exchange, and smart contracts. Blockchain technology facilitate the creation and registration and verification of the token standards. They enable secure and transparent access to PHIs, personal health information, while maintaining privacy across the transactions. Thus, by leveraging blockchain, healthcare organizations, they can enhance data security and transparency. This is the keyword which we have been hearing over the last 5-10 minutes across my applications of blockchain in healthcare. They are ensuring that the sensitive information, they remain protected throughout its life cycle. That was the last thing. I just want to touch base upon a couple of references. It's very interesting read, some of the papers, research articles as well. Do go through it. It will give you a more broader aspects how blockchain specifically is impacting healthcare administration and its automation. To summarize or to just wind up my presentation, and then I'll open for Q&A. Thus, we can say like future of healthcare, which is currently being shaped by blockchain. It really holds exciting possibilities for improved care and operational efficiencies. And this journey is not just about technology adoption. It's about redefining healthcare to be more secure, efficient, and more importantly, patient-centric.
Thank you so much for your presentation.
Right. Thank you so much, Mr. Akil Ahmed. Over to you.